In my sports medicine practice, my primary goal and responsibility is to return my patients to their full active lifestyle and their sports as quickly and safely as possible. Arthroscopic surgery has enabled all of us practicing sports medicine to greatly improve our efficacy and efficiency in not only treating these types of injuries, but also in returning athletes to their level of sports and activities. In previous years, operations that would take 4 hours or longer now can be done in 1 hour to 2 hours and enable people to go home the same day as their operation. This greatly benefits them in decreasing their pain, decreasing their post-operative recovery period, and greatly increasing their ability to get back to the sports they love and want to participate in as quickly as possible.
Well, I play soccer and I was playing forward, and I was running down the field to the goalkeeper, and I passed it off to one of my teammates, and the goalie kept running at me, and we just collided and hit knees, and I was just knocked out, and I woke up a little bit later with people standing around me, and then I got carried off the field, and it was just so painful. I tore my popliteus tendon, which is on the right side of my right leg, and my lateral collateral ligament, which is on the right side of my right leg too. It was so frightening because I love playing sports, and to think that I couldn't play sports anymore was just so sad. Physical therapy was really hard. They made me do a lot of work, and it was really tiring and sometimes boring too, but it helped me out a lot. And what really made me want to come back to playing sports was just coming out to San Mateo and watching my team play, and it was just really hard to just sit on the bench, so I just wanted to come back really fast. About a year ago I had my surgery, and 7 months later I was able to play again. I started playing volleyball and soccer, and now I'm on the varsity soccer team. My leg feels great. I can do everything. I can kick a ball, I can pass it, I can run. I feel great, and I can do pretty much everything I could do before.
I was very active in sports, and I played basketball, played baseball, played rugby in college, and I rolled my ankle. I sprained my ankle, my left ankle, about 12 or 13 times. Excruciatingly painful every single time. Every successive time that I did roll my ankle got weaker. I always wanted to be the father that would play basketball, would play baseball with my son, and I knew that my weak left ankle, because I sprained it so often, would put a damper on a lot of that. I went to Dr. Diefendorf at Mills-Peninsula, and he recommended a procedure. It's called a brostrom, essentially taking a tendon, one of my 4 tendons from behind my knee, removing it, drilled 4 holes into my ankle, and then wrapped the tendon as a figure 8 to stabilize my ankle. It was a pretty lengthy rehabilitation process. I was placed in a cast for probably about a month and a half. I was pretty much immobilized. Had to keep my ankle elevated at all times, even when I slept. So it's been about 3.5 years since I've had the procedure done, and I feel great. You know, I went through my physical rehabilitation, and I still, adamantly work out. I'm more mobile than I have been in a very long period of time.
This is an example of an arthroscope. An arthroscopic technique typically will involve a small tube like this with an arthroscope passing down the tube. And we have a camera attached to the arthroscope itself here with a light source coming in this area. And what this will enable us to do is to visualize the joint itself with the transmission of the image to various screens, as you can see around the operating room. We are then able to manipulate the joint, able to move instruments in and out of the joint through different types of portals to gain visualization, and we can greatly improve our efficacy and greatly increase the ability to do the best job we can for our patients. In my practice, I very commonly repair rotator cuffs, knee ligaments, and menisci through arthroscopic techniques. When doing so, we use very small incisions, no more than 2 or 3 millimeters. We usually would make 2 incisions for a knee, and typically 3 or even 4 incisions for a shoulder. What we would then do is be able to move the arthroscope from each incision to each incision. And again, these are very small incisions. They're only about 2 millimeters or 3 millimeters long. Therefore, they leave very, very fine scars, and most people don't even notice the incisions after about 6 months. One of the truly wonderful things about our new operating rooms at Mills-Peninsula is the fact that we are able to walk around the room without worrying about tubes, wires, or other devices that may get in our way. We have easy access to the operating room table, as you can see right here. We can walk around each side of the table, and we also have access to our video screens here. These transmit the images from the operating surgery areas that we are working on to the screens that we can visualize. These are easily movable, they are mobile, and we can actually use these to be moved wherever we need them to be to enhance our ability to do the surgery. I'm very excited and privileged to be able to practice sports medicine at Mills-Peninsula Hospital. The technological advancements that you see here in the operating room are second to none. They are state-of-the-art, and they enable us to provide outstanding personal care in the best possible way that we can to get our patients back to their full active lives and participate in sports.
Well, I love to play golf. I love to swim. Swimming laps is just one of those things that really, really makes me feel good, body and soul. And I couldn't do it. I couldn't swim laps, and that was one of the things that really told me there was something wrong with my arm. And finally, when I got an MRI about a year ago, it was revealed that this was a serious tear in my rotator cuff, and was told that really, at my age and with an old, long-standing injury, usually they just don't correct that. And then I went to Dr. Diefendorf for possibly one last opinion, and he was the one who said, yes, I think I can help you. He said it would be in and out, one-day surgery. It would be minimally invasive and arthroscopic, which meant a little light-borne thing went in 2 holes and then turned out to be about a 1-inch incision. I was home by 2:30 or 3 in the afternoon. I so strongly believe that you've got to always keep your body active. And one of the reasons I believe so much in the physical therapy aspect is that I didn't want to do anything to hurt the repair job, because I knew it wasn't finished until it had had time to completely grow as the doctor wanted it to. I went 2 days a week, and it was a half-an-hour appointment, and the therapist worked with me to have me doing the things and doing them right. That's the other thing, having someone watching you and guiding you. I have played golf for a number of years with a women's golf group that has so much fun, but I have never, ever been the winner of the monthly trophy plate. And this month, with my new shoulder, I came away with the trophy plate.